8 signs. You have a fatty liver. Your liver is an essential organ that helps process what you eat and drink. Fatty liver is a condition where your liver accumulates more fat than it should. It normally has a small amount of fat, but when there's an excess of fat, it can lead to fatty liver, also known as hepatic steatosis. This excess fat in your liver can be due to various reasons, such as eating too much fatty food, being overweight, or excessive alcohol consumption. Over time, having too much fat in your liver can cause inflammation and damage to your liver cells. Moreover, fatty liver, if left untreated, can progress over time and lead to more serious liver conditions such as cirrhosis, liver failure, and liver cancer. So, recognizing the signs early can help you take steps to reverse the condition. So, let's get into the 8 signs of fatty liver disease. Number 1. Unexplained fatigue. One of the most common symptoms of a fatty liver is feeling tired all the time. Your liver is like a central processing unit for your body. It helps with digesting food, cleaning out toxins, and maintaining your overall health. But when fat builds up in your liver, as in fatty liver disease, its ability to perform its tasks is impaired. Even after a full night's sleep, you might wake up still feeling tired and not refreshed. That's because your body's energy isn't being replenished as effectively as it should be. Everyone feels tired now and then. But if you're constantly feeling drained without a clear reason, your liver might be the culprit. If you are experiencing persistent fatigue, it is highly advisable to see a doctor. Number 2. Abdominal discomfort. Your liver is located in the upper right part of your abdomen, right below the rib cage. When you experience abdominal discomfort or pain in this region, it could indicate an issue with the liver or nearby structures. In the early stages of fatty liver, the liver may enlarge due to the accumulation of excess fat. The enlarged liver can press against surrounding organs and tissues in the abdominal cavity, leading to discomfort or a feeling of fullness. Number 3. Unexplained weight loss. Unexplained weight loss in fatty liver occurs because the liver isn't working properly. The liver usually helps control your body's energy balance, but when it's fatty, it can't do its job effectively. This can result in a reduced appetite, making you to eat less than you should. Also, fatty liver can change how your body uses and stores energy, causing it to burn stored fat and muscle, which leads to weight loss. Unexplained weight loss can be a sign that your liver isn't as healthy as it should be. If you're losing weight without trying, it's advisable to see a doctor for an evaluation to understand the cause and receive proper care. Number 4. Dark urine. Dark urine typically occurs due to the presence of excess bilirubin in the urine. What is bilirubin? Bilirubin is a yellowish pigment produced during the normal breakdown of red blood cells. It's usually processed by the liver and then excreted in the urine, giving urine its normal pale yellow color. In fatty liver, the liver's normal functions can be disrupted due to the accumulation of excess fat. This may affect the liver's ability to process bilirubin and other substances effectively. As a result, more bilirubin can end up in the urine, causing it to appear darker than usual. If you have dark urine, especially if it's persistent and accompanied by other symptoms like abdominal discomfort or fatigue, it's important to consult with a healthcare provider. They may perform blood tests to assess liver function and determine the cause of the dark urine. Number 5. Skin itching. Skin itching can occur when the liver is not working well. In fatty liver, the liver's ability to clean a substance called bilirubin from the body is reduced because of the extra fat in the liver. When bilirubin and other waste products build up in the blood, they can make the skin itchy. So, skin itching, particularly when it's persistent, can be a sign that the liver is under stress or not functioning at its best. If you're experiencing skin itching, especially in combination with other symptoms associated with fatty liver, it's important to consult with a healthcare provider. They can perform tests to assess liver function and determine the underlying cause of the itching. Moving on to number 6, nausea. Nausea is when your stomach feels uncomfortable, and you might feel like you're going to vomit. Nausea can be a sign of fatty liver because when your liver has too much fat, it doesn't work as well as it should. Your liver plays a big role in processing things in your body, including getting rid of waste and toxins. When it's burdened by an excess of fat, it can't perform these functions as effectively as it should, which leads to feelings of nausea. However, it's important to remember that nausea can be caused by many other things too, so it's essential to see a doctor for a proper evaluation and diagnosis if you're experiencing it along with other symptoms of fatty liver. Number 7. Enlarged liver. An enlarged liver, also known as hepatomegaly, is a condition where the liver becomes larger than its normal size. An enlarged liver can happen when there's an increase in the size and weight of the liver. In the case of fatty liver, the accumulation of excess fat within liver cells can contribute to this enlargement. The liver may become swollen and larger than its usual size. To confirm if you have an enlarged liver usually requires a doctor's evaluation. However, there are some signs and symptoms that might indicate you have an enlarged liver. For example, you may feel a dull ache or discomfort in the upper right side of your abdomen, where the liver is located. You may also have a sensation of fullness or bloating in the upper abdomen. If these symptoms continue or worsen, it's important to see a doctor for a thorough evaluation and diagnosis. During a physical examination, if a doctor notices your liver is bigger than it should be, they'll often order some tests like ultrasounds, CT scans, or blood tests. These tests help them check how well your liver is working and figure out if you have a fatty liver or other liver issues. Before we move on to the next point, please subscribe to our channel and like this video. Number 8. Elevated liver enzymes. Liver enzymes like alanine transaminase, ALT, and aspartate transaminase, AST, can be found in higher amounts in cases of fatty liver or hepatic steatosis. When the liver becomes inflamed, it reacts by releasing more of these liver enzymes into the bloodstream. Moreover, when there is an excess buildup of fat within liver cells, it can cause damage and harm to these liver cells. As a result of this damage, liver cells release ALT and AST enzymes into the bloodstream. So, if you have any concerns about your liver health or suspect liver problems, it's advisable to undergo a blood test to check for elevated liver enzymes. A blood test is the primary and most reliable way to assess the levels of these enzymes, which can give you important information about your liver's health. We've covered the 8 important signs that may indicate a fatty liver. Thank you for watching our video. Please subscribe and watch our next video.